My name is Mary Bitta. I am a PhD student registered at the University of Oxford at the Department of Psychiatry, working under the EPINA study and one of the investigators of the mhGAP study. My primary role in the study is to coordinate the activities, and I'm also a master trainer who trains the trainers. The mhGAP stands for the Mental Health Gap Action Program, and it was developed by the World Health Organization in 2008 and subsequently revised in 2016. Its aim is to build capacity among primary healthcare workers who are not specialized to enable them to diagnose and manage priority mental, neurological, and substance use disorders, specifically epilepsy, depression, psychosis, dementia, substance use disorders, child and adolescent mental and behavioral problems, suicide or suicidal behavior, and other significant mental health complaints. Here in Kilifi, the study is targeting 128 primary care facilities, and our training design includes training a cluster of 8 facilities, and therefore our estimated training time will be a total of 16 months. After every training, we follow up our trainees quarterly with supervisory meetings, which are offered by specialists. In this case, in the case of Kilifi County, these are 2 psychiatric nurses, 1 clinical officer trained in psychiatry, and 1 clinical officer trained in the management of substance use disorders. The study was informed by the results of a situational analysis that we did in 2017 that showed, among other things, that the human resource for mental health in this county is limited, despite other studies showing that the burden of these disorders is very high in this setting. The primary outcome of our study is actually changes in proportions or the rates of cases detected at the primary care level. And the secondary outcomes of our study include things like the quality of life of the patients will be managed by the trainees, their levels of disabilities, as well as the stigma levels of the trainees after the intervention. We hope that in the end that this Kilifi becomes the blueprint or the template for scaling up of such activities in the entire country. And we also hope that our stakeholders and the policymakers can take this up and scale it to the other facilities that we were not able to reach, primarily due to constraints in resources, because this training is very resource intensive.